Welcome to The Explainer. Today, we're diving into a really fascinating study, a landmark one actually, that put a new kind of medical AI to the test, where it truly counts in the real world with real patients. So I want you to just picture this for a second. What if your next doctor's visit started with a chat? Not with a nurse, but with an AI. Well, you know what? This isn't science fiction anymore. Researchers just recently tested this exact idea for the very first time with actual patients. Okay, so let's get right into it. The big goal here was pretty straightforward, but also pretty ambitious. Could a conversational AI safely and helpfully gather a patient's medical history before they even see a human doctor? We're going to look at how they designed this whole thing, the safety nets they put in place, and, of course, what they found out. All right, first things first, let's meet the AI at the very heart of this study. Its name is AMIE, and that's short for Articulate Medical Intelligence Explorer. Now, I want to be super clear here. This is not your average, run-of-the-mill symptom checker that you find online. You know, the kind where you click a few boxes? No way. AMIE is what's called a conversational diagnostic AI. That means it's built to have a really sophisticated back-and-forth chat, to actually perform clinical reasoning, kind of like a real doctor would when you first sit down with them. And look, it's one thing to prove an AI works in a sterile lab environment, right? But the real test, the question that really matters is, how does it hold up in a real clinic with real patients and all the unpredictability that comes with that? That's the huge leap this study was trying to make. So that brings us to the design of the test. I mean, how do you even begin to safely test a totally unproven AI in a primary care clinic? When you're dealing with real people's health, obviously safety is job number one. So here's how they set up the patient's journey. It was basically a three-step process. First, the patient would have a text chat with AMIE about their symptoms. Simple enough. Then, they'd go have their normal visit with their regular doctor. But the doctor would already have a summary of that AI chat. And then the third step, and this is really clever, an independent panel of doctors would evaluate the AI's performance. And the kicker is, they didn't know which notes came from the AI and which came from the human doctor. That's called blinding, and it's a great way to avoid any bias. But remember how I said safety was job one? Well, here's how they did it. This is the human safety net. For every single chat between a patient and the AI, a human doctor, an AI supervisor, was monitoring the conversation live, in real time. They had a list of 4 things to watch for, and if any of them happened, say the patient was getting really upset or there was a hint of clinical harm or anything serious like that, that supervisor could jump in immediately. So the bottom line is a human was always in the loop, ready to take the controls at a moment's notice. Okay, so with all those safety measures locked in, the study went ahead with 100 patients. So how did it go? How did AMIE actually stack up against experienced human doctors? Let's get to the results. This right here might be the single most important finding in the whole study. The number is 0. That's the number of times the human supervisors had to step in and stop the AI chat. Out of 100 interactions, not once. That's a huge piece of evidence suggesting that, at least from a conversational safety standpoint, the system worked flawlessly. Okay, so it was safe, but was it any good? Well, when it came to the actual clinical quality, the results were, frankly, just as striking. So remember that independent panel of doctors, the ones who were blinded? They reviewed the workups from both the AI and the human doctors, and they rated them as basically equal in overall quality. Think about that for a second. No significant difference. That is a huge deal. It suggests an AI could potentially handle that complex initial diagnostic work, which could completely change how a clinic operates. But when you dig a little deeper, you start to see where each one shines. It's like a tale of the tape. AMIE, an absolute beast at clinical reasoning. It was incredibly accurate, even including the right final diagnosis in its list about 90% of the time. But the human doctors, they were better at creating plans that were practical and cost-effective. And why? Well, because they had the whole picture, right? The patient's full medical record, the ability to do a physical exam, and they could read all those nonverbal cues. So this isn't about replacement. It really points to a future of powerful collaboration. All right, the clinical data is impressive, for sure. But what about the human side of things? I mean, how did this whole experience actually feel for the people involved? Did patients trust this thing? Did the doctors find it helpful or just a hassle? This is absolutely fascinating. So the researchers had patients fill out surveys about their trust in AI at 3 different points: before the chat, right after, and then again after they saw their human doctor. And the results were crystal clear. After chatting with Amy, patient trust in AI in healthcare went up significantly. Actually using it made them trust it more. And what about the doctors? Well, they found it pretty useful too. This quote from one of the doctors in the study really says it all. Because the AI did all that initial kind of tedious data gathering, the doctor's job changed. It went from asking a long list of questions to verifying information. Just think about that. It means less time on routine stuff and more time for actual conversation, for collaboration, for real decision-making. It's a way to maybe give doctors back the one thing they never have enough of, time with their patients. Okay, so this was a really successful, really promising first step. But, and this is important, the researchers themselves are very clear that this is just the beginning of the road. So, what's the big takeaway here? This study is awesome evidence that this is feasible and can be done safely. But we have to be real about the limitations. And the researchers are. I mean, this was just at one hospital. The chat was text only, so you're missing all the nuance of voice or video. And they didn't have a control group to compare it against the normal way of doing things. So there's more work to do, for sure. They need to do larger studies and look at things like how a person's comfort with technology affects their experience. So really, this whole study gives us this incredible glimpse into a possible future. A future where an AI is a kind of helpful assistant, handling the groundwork so that your doctor can focus more on, well, on you. The question really isn't if this kind of tech will become part of our healthcare anymore. The real question is how we can best and most safely weave it into the very human art of medicine.